And let's start off by talking about your new practice, where you're located, and how you've gotten to where you are.
Okay, the name of the practice is Bremner Family Medicine, and we are located at 136 Corporate Park Drive. That's in Mooresville, in the Morrison Plantation area, across from Horizon I. And we offer services basically to all age groups, pediatrics all the way up to the elderly. And I do a lot of minor procedures such as lumps and bumps, abscesses, joint injections. We do complete physicals, DOT physicals, sports physicals, you name it, we do it. Pap smears for the woman. And we, I've been there since February of last year, pretty much. And initially, I am from Trinidad and Tobago, and yes, and I did my medical school in Mona, Jamaica, and from there I moved to Nassau, Bahamas, where I did an internship period, and then moved to New York, in Brooklyn, where I went to State University of New York for my family medicine residency. Subsequent to that, I moved over to North Carolina. I was in the eastern part of the state, and in 2007, I moved to Iredell County, and as I said, last year, I moved into my new practice.
And I bet you're missing the nice warm weather from where you're from.
Oh, yes.
Although
yes.
it's in Brooklyn, it's SUNY, so it's not great in the winter in Brooklyn. I love the family medicine practice. I mean, I don't really think that was as big up north, but it's nice to have the whole family go to one doctor, and then the doctor really knows your whole family, and you can also, I double up, bring both kids in at the same time.
Yes, exactly. I have lots of families, they just come in all on the same day at different times. You know, we schedule them that way. And it's easier, especially with gas prices and stuff. People try to do everything at one time, so it's helpful.
So let's talk a little bit about the approach to childhood nutrition and just keeping your children healthy, because there are a lot of medical concerns. You keep hearing more about obesity and diabetes and even high blood pressure in small children.
Yes.
And there is that approach, both traditional and holistic. So what is your perspective on all that, and what would you recommend?
I myself don't do a lot of alternative treatments or recommendations. However, I'm always open to dialogue with the patient, the family, and direct them to adequate websites that they can look up the safety of these medicines, because a lot of the herbal and alternative remedies, they're not FDA, approved, and as such, there are a lot of they're not regulated as well as the other well-studied traditional medications. However, there are some things that have been shown to work and have been shown to have no dangers in terms of alternative therapy. And things like probiotics have been shown to improve GI health and help with diarrheal illnesses. Ginger tea has been shown to be very good for nausea and stomach upsets. Echinacea has been shown to be very good with the sniffles, colds, and stuff. A lot of people take vitamin C when they have a cold, but I don't think it has been shown to be effective one way or the other. We've noticed that a lot more people have been needing vitamin D. It's boosts the immune system, and it's the biggest thing now, even adult patients. And in the pediatric population, we try to encourage parents to give them at least 400 to 800 international units per day. A lot of times just the regular multivitamins, the gummy vitamins stuff, that would have sufficient vitamin D in there. And those are some of the good alternative remedies or supplements that have been shown to be good. I actually read about one that I didn't know about this morning, and that was honey for cough. But we try not to give those to kids less than 1 year. But they've been shown to work, but we also have to be cautious because they're not regulated very well.
What do you see as the biggest issue in this area with children?
Obesity.
Obesity.
As a matter of fact, I recently did some physicals at an area school, and that was obviously the major problem. And in addition to looking at their blood work, another major problem was problems with cholesterol, dyslipidemias already.
Is it lack of knowledge, or is it?
I think pretty much as time goes on, we've moved away from activity so much. We do a lot of sedentary lifestyle, and as such the weight goes on. So we're putting in more, but we're moving less. Yes. So activity is key. It's recommended now that kids actually get 1 hour of activity every day, and we try to make it not something that's boring, but something that's playful. And it's found if the parents get involved and, as a family, have fun, play ball, kick a soccer ball, stuff like that. Yes. And actually I take my daughter to roly-polies, and that was the main reason that I did, because she was getting a little bit weighty, and I said that's a good avenue for her to have fun and yet be active.
Kids like to be active. I mean, my daughter will sit there and jump rope in the front hall, which drives me nuts. But once they start moving, they want to keep moving.
Yes, and that is really key to controlling obesity.
Now you're involved in a pilot program at a local area school at Brawley Middle. What is that like, and what's the ultimate goal with that program?
The ultimate goal with that program is to try and get kids more active, lose weight, and just to be more healthy, ensure that they are not at risk for diabetes, ensure that they are not at risk for hypertension, and ensure that they are not at risk for the dyslipidemias or the hypercholesterol and the metabolic syndrome that we've heard a lot, more in the news over the recent years. So what we did was we got them to take the blood and then reviewed them, and it was really surprising how many had problems with the cholesterol.
That's amazing, and that's 6th, 7th, 8th grade.
Yes, young kids. And a lot of them, we picked up hypertension and had to have them follow up, as well as we picked up quite a few what we'll call abnormal sugars, not yet in the range of diabetes, but certainly in the range of what we call pre-diabetes. So those kids have to be monitored more closely, have strict nutrition counseling, and really have more activity in their life.
Do you think it's a problem that the schools have cut so much? I mean, they don't have quite the physical education programs that they used to have, and so to do a lot of the sports leagues, you've got to pay a fee, and it gets expensive.
And yes, that is true. Plus, in the schools, there are a lot of the dispensing machines sometimes that you get those foods that may not be, maybe high in sugars and fats. And I knew recently there was something about restricting what is dispensed at the school from vending machines, and I think that's a good idea, because then the kids start learning how to eat healthier from a younger age.
Yeah, absolutely. Yeah, what teenage kid isn't going to go get some Fritos out of the machine instead of eating their apple?
If I see an apple, I'm going to get the Fritos instead, quite honestly.
Do you find the children receptive to this now, that you're telling them, here's a problem, and a lot of it is because you're not active, you're not eating correctly? Are they saying they don't care, the teenage, or is it more they?
The majority of the ones that I've spoken, they're receptive, and if you try not to be too dogmatic about it and tell them in simple steps, things like, okay, just reducing your juice,
right?
Or just eat out at McDonald's instead of every day or 3 times a week, cut it down to maybe just on weekends. So doing little things, manageable things that they can do, manageable things, not, you set the goal not too high, and when they start out that way, then it's easier for them to have success. Once they get success with the little things, then we can increase it and restrict other things. So a lot of the times I just start out very small, cut the juices out, the sodas, one thing at a time, and then we move from there.
Yeah. Well, that's great.
Well, you bring up a good point too. We've heard about the sodas. It's amazing how much actually drink soda.
Yeah, it has a lot of calories.
But you've got a lot of great information. We'd love to do a follow-up with you on the pilot program and how that goes, and see. But thank you so much for being our
Thank
featured
you
business.
so
we
much
appreciate
for
it.
having
It's very
me.
nice to
Thank
have you on the
you.
show.